Good, how are you?
Pretty good. My name's Courtney. I'm going to be doing your wellness exam, okay? Let's start off. How you doing today?
Good, good.
Good. Okay, so just to give you a little rundown, I'm going to get your vitals, and then I'm going to move from head to toe, and then I'm going to have you stand a little bit, all right?
Okay.
Tell me your first name, last name, and your birthday.
Sherry Rive, birthday 11/10/69.
Wonderful. Okay. And then where are you right now?
Community,
And what's the date today?
August 14, 2019.
And why are you here?
To get a physical.
What's the season?
Summer.
Getting you all over the place. There we go. Okay, I'm gonna get your temperature. And just breathe nice and easy. Okay, 98.3 is our temperature. I'm gonna give you a respiratory rate of 14. Just writing some of this stuff down for us as well. Okay, I'm gonna go ahead and just check your radial pulse. I do feel that. I feel this. Okay. Okay, we'll say that's about 80. Good. Now let's go ahead and get your blood pressure. Good. Okay. Let's rest your arm down for me. There we go. It's gonna be a little tight. And making sure not to overinflate. Okay, there we go. 110/70, nice and even. It's a good blood pressure there.
Good.
Write that down just 1 second. Okay. And how much do you weigh?
165.
And how tall are you?
5'3".
Okay, that gives us a BMI of 29.2, just a little bit over, but that's okay. Nothing that you can't fix, okay? We can't fix. All right, and then you have contacts, right?
Yes.
Okay, we're gonna go ahead and check some vision. I'm gonna hold, this is a little guy, so I'll hold this out about here. I want you to go ahead and just read that bottom line for me.
LTFPH.
Good job, got it. We'll consider that 20/20, and you have your contacts in, correct? Okay.
Yes, I did, ma'am.
Wonderful. Okay. I'm looking at your general appearance. I would say you're in no acute distress, appear to be breathing just fine. I don't see any issues, just an immediate appearance of the skin as I'm looking. I'm gonna go ahead and just look at your head, just looking around. Wonderful. Skull appears round with no apparent abnormality that I can see, no type of bumps or protrusions. I'm gonna go ahead and just feel, looking for lumps, bumps, and indentations here. Normocephalic, okay. I'm gonna look at the scalp, looking at all throughout, and looking for any lesions, redness, any skin issues, rashes, and I don't see any all throughout the scalp, okay? Next, I'm gonna go ahead and just look at your eyes. I do see that you obviously have one on each side. I'm gonna go ahead and just check your pupillary light reflex, okay? Good. Wonderful, I'm noticing about a 3. We'll consider your pupils equal round, reactive to light. Sclera is white, look up and look down. Oops, look down, good. And conjunctiva is pink. I want you to go ahead and just look at this here and follow, okay? Don't move your head, just your eyes. As I'm looking through those cardinal positions of gaze, checking extraocular motor movements. I don't know any type of nystagmus, everything is nice and smooth. I'm gonna go forward, just follow this. Convergence, there we go. And I do see your pupils constrict. Okay, wonderful. And I do also see that the eyebrows are as they should be. I'm looking at the nose, it's midline without turbinates. I see that each side is equal in the nares. Also, I'm looking at the septum, and it is in midline as well. Go ahead and cover each side and below for me. There we go, and the other side. Any issues?
No.
Okay, so airway is functional. Okay, wonderful. I do want you to go ahead and give me a squeeze, smile, frown, stick your tongue out at me. Wonderful. So as I'm looking at Your face, cranial nerves 5, 7, and 12 is what I'm checking. And throughout this whole time, I'm also listening to your speech, and we'll also test our hearing and look inside. When we do that, we'll listen to 8, 9, 10, and 12, make sure those cranial nerves are intact as well. Okay, we'll kind of just move down with those.
All right.
So go ahead and just kind of sit there looking at the ears each side. I don't see any issues in the external auditory canals. There was no abnormality within the feeling. They're nice and soft. I'm going to go ahead and just take a little listen inside. Okay. There we go. Get our light going. We do have our little cover. Okay, I'm making sure that, there we go, tympanic membranes is nice and pearly gray, which it is. I don't see any signs of redness or inflammation indicating infection. I'm going to go ahead and listen to look at this side. Wonderful. And that is the same on that side as well, nice and pearly gray. No signs or symptoms indicating infection. Wonderful. Just what we're looking for. I'm going to go ahead and just do some hearing. I can tell right now that your speech is clear. I can hear you. There's no slur or anything like that. I don't see any type of droop in the face.
Yep.
Okay, let's check on this side.
I can hear.
Okay, wonderful. So all of that is intact. So speech and hearing 8, 9, 10, and 12. And visual acuity is intact. Your vision is as well. Extraocular motor movements and cranial nerves 2, 3, 4, and 6 are intact as well. I'm going to go ahead and just slip on my gloves here. And I'm going to look at your mouth, okay?
Okay.
Just in looking at first glance, I don't see any lesions on the lips. They do appear nice and pink, midline on the face, okay? Oh, let me get my light. Open your mouth for me. Stick your tongue out. Say ah. I do see that soft palate and uvula that is midline rise. The tongue is nice and soft and a little bumpy lift up for me. I don't see any type of oral lesions. Looking around, maybe some fillings, but dentition is all intact. And just relax that tongue one more time. I don't see any redness or anything in the back of the throat. Okay? Wonderful. I want you to go ahead and just, as I push down, I want you to shrug it. Good. And I want you to push down. Go ahead on this side. Wonderful. Now look this way. Up, down. Wonderful. As we do that, we're checking for that shoulder. As we do this, we're checking for cranial nerve 11, which is also intact. Okay? Wonderful. And I'm looking at all of your motor movements within the neck, and everything is normal. And as I also look down, I'm looking at the throat, I'm looking at the chest, just doing a quick inspection. I do see that the trachea is nice and midline. I'm going to go ahead and just feel your neck, okay? And as I do that, I'm just checking for lymph nodes. Any type of lymphadenopathy is what we call that, swollen glands all throughout. Okay, that neck here, I'm going to do the whole chain. Okay, good. I don't feel any type of lymphadenopathy. Okay, go ahead and put your arms out for me. Just inspecting as we did before. No type of lesions, rashes, redness, sores, open wounds, anything like that. I'm going to feel with the back of my hands that temperature is nice and warm and dry. Wonderful. I'm checking radial pulses, +2, regular rate and rhythm. Give me a big squeeze. One, big squeeze. Sorry. Good. No, it's okay. Checking cap refill as I do this. I want in all 10 digits there. Less than 3 seconds, and also nail beds are nice and pink, okay?
Yes.
Just hold those out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. Okay, sure, I'm gonna go ahead and just give you a little listen to you just a little bit. And also, as I did look throughout your arms, I didn't notice any type of swelling
No,
or anything
I don't
like
have
that. I
anything
didn't
like
notice that.
No.
So we'll go neck, I'll listen to your chest, front, back, and side to side, and we'll also listen to your cardiac sounds, okay?
Okay.
Listening for any bruit, which I do not hear. Good. Wonderful. I don't see any type of issue within your effort of breathing. Appears regular and non-labored. Chest, it looks like it has an equal rise and fall. Just give me some nice quick breaths as we do this. Good. I'm doing all 8, anterior and posterior. Keep breathing. Outside and outside. Good. I'm going to go ahead and just do lateral since I'm right here. And as I do this, I'm listening for 3 sounds, or 3 spots on this side. Good, we'll do 2 on this side. And as I do this, I'm also noticing her range of motion and then her arms. Is nice and within normal limits, moving all extremities. Good. So far, clear to auscultation, just as we would want. Listening to all 8 spots, right, left, and then one on each side there, the end, the base. Following order here. Okay, and our last spot. Okay, wonderful. We checked 8 spots, anterior and posterior, or 3 on this side and 2 on this side. Overall, your lungs are clear, I would say. No issues there. I don't notice any cough on you either, okay?
No,
So finally, I just want to kind of let you know that. Now I'm going to listen to your cardiac sounds, okay? And as I'm doing this, I don't want to hear any S3, S4, no murmur, anything of that nature. Listen, here we go. Listening for that aortic sound. Harmonic. Tricuspid. Mitral. Looking at the midclavicular line, 5th intercostal space there. I'm looking at that apical pulse of point of maximal impact there. Just to be complete.
You're okay.
Okay, there we go, good. Good deal. Okay, so now I'm gonna go ahead and have you lay back.
Okay.
Alrighty. There we go. Looking at that strength, that was good there. Okay, there we go. I am gonna look at your abdomen, Sherry, okay?
No
I'm just
problem.
gonna expose all of the abdomen. And as I do this, I'm looking at the shape, I'm looking at the rise and fall. I do see just a little bit of rounding, but nothing that big of a deal. I also see a scar at the right lower quadrant here. Looking, no real issues with skin. I'm gonna go ahead and listen. We'll check each 4 quadrants and then any area that we could possibly hear vascular sounds, which we do not want to hear in this case. Good. Now I did hear gurgles on all 4 quadrants, and then I do not hear any vascular sounds left, midline, or in that right area, okay? Now I am gonna just give you a little pressure, we'll do light, and then I'll do deep, okay? Let me know if you feel any type of tenderness or pain, okay? You doing okay?
Yes, I'm fine.
As I do this, I'm feeling for any type of enlargement, any type of mass, or anything of that nature. I'm gonna get a little deep. There we go. Any issues there?
No.
Okay, I'm also going to do a little bit of percussion. A little dullness in that area of the liver, which is normal. Okay, I don't hear any inappropriate dullness or tympany or anything like that, okay? I'm gonna go ahead and we're gonna move down to the legs here. As I'm looking, general inspection, also keeping her body covered. I don't see any type of redness, lesions, varicosities anteriorly. I'm gonna just look a little bit. There we go. I don't see any of that posteriorly as well. As I move down, I'm just checking temperature. Skin is warm, dry with that nice pink appearance. I'm also going to go down, just feel for any abnormality, any, there we go. I don't feel any type of edema pitting or non-pitting. Definitely no swelling, wonderful. Good, I don't feel any lumps, bumps, protrusions, anything like that. Go ahead and raise. 1, 2, 3, 4, 5. Raise. 1, 2, 3, 4, 5. And I want you to scrape your heel up and down. Good. And do the same on the other side. Good deal. Okay. Then I want you to push down and pull up towards me. Wonderful. Okay, and I want you to kind of just move your leg out and in. Do the thing with the other side. Now pull up towards your chest with your knee. Good, wonderful, and pull up. Good. Strength is nice and intact. Also, is range of motion. Okay, I just want you to also tell me, we're going to do a little bit of sensory. Okay, I want you to tell me if you feel this. This is soft. Keep your eyes closed as well. Tell me when you feel.
Feel. Feel it. Feel. Yes. 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 Yes.
Here we go.
Yes.
Okay, good. Sensory soft is intact there. Wonderful. Okay, this is going to be our dull. This is going to be our sharp. Okay? I just want you to tell me which one you feel.
Okay. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sorry.
No, you're okay. Last one.
Sharp.
Good. Okay, nice. And now I'm also going to give you just a little bit of a scrape here.
Okay.
And we want to check the Babinski reflex there. As we see, we did get a pullback, which is appropriate, especially when somebody is a tickle. Otherwise, you just want to see a little bit of a curl. All right. Wonderful. Go ahead and sit up for me.
Okay.
Oh, wait a second. One second. I don't think I checked your calf refill on your toes.
Oh,
did I?
I'm sorry. I don't think so.
Well, if I do, we can do it again. Not a big deal. Okay, good. Looking to make sure, just as we did in the feet, that we do feel our pedal pulses 2+ with palpation, and also that we do have appropriate calf refill, which is brisk in all 10 digits, okay? Less than 3 seconds.
Okay.
And our nail beds are pink. Okay, go ahead and sit up for me.
Okay.
I'm just going to check some of those deep tendon reflexes, okay? I'm going to grab this here, and I just want you to kind of lift your arm out. All right, sometimes we don't always get a large reaction, but I do want to feel that. Good. That tendon. Okay, good. And I did actually see in both. It's kind of nice. Patellar.
Sorry.
You're, let me get you again. Patellar. Just get it. Okay, just nice and easy. Okay. There we go. All right. Okay, Sherry, go ahead and stand up for me.
Okay.
Wonderful. Okay, I want you to take a few steps forward. Okay, now come back towards me. I'm looking at your gait. Gait is steady, balance is appropriate. You use the heel-toe pattern to walking. I don't notice any stooping or imbalance within your posture. Okay, I want you just to twist at the trunk up top. Just twist, yep, and twist, twist, twist. Wonderful. Now I want you to lean forward. I'm gonna go ahead and just, as we did before, we always look at skin like when we're looking at posterior breath sounds, but now's a good time as well. I don't see any type of abnormality in the skin, no rashes. I do see some little freckles and some moles, but other than that, everything is normal, no type of skin issues. I also see that nice convex and then concave pattern to the spine. I'm gonna go ahead and palpate, just checking for any abnormality in the actual vertebrae, bones within the spine, looking at the folds. Everything does appear as it should be. Wonderful.
Good to go.
Stand up for me. Okay. And just turn around. We're going to do the Romberg test. I want you to close your eyes, and then I just want you to stand here for a minute. This is also something that we don't want to see a lot of swaying or anything. So go ahead and close your eyes and just look forward. Just minimal sway. Wonderful. Good job. Okay, now I want you just to take finger to nose, okay? All right, here we go. I want you to touch there we go. And we're gonna move, okay? So just follow. Go ahead. Wonderful. One more. Okay, I think we did them all. Wonderful. Thank you very much, Sherry.
Well, thank you very much for
I hope you have a great day.
Thank you.